Welcome to Mayo Clinic and Corporate Social Responsibility. This presentation discusses the organization overview, what corporate social responsibility is, leadership competencies tied to corporate social responsibility, and Mayo Clinic's current initiatives including food waste, community outreach, and research. Mayo Clinic is world famous for their healthcare delivery, and they run as a not-for-profit organization. The key strategic initiative for this not-for-profit is to secure Mayo Clinic's in Minnesota status as a global medical destination. The general external environment of Mayo Clinic has many crucial aspects. Stakeholders hold majority in determining strategy when considering the macro environment. A stakeholder analysis is required to determine if they support the strategic initiative and whether their support is required. The primary competition is prime competition when it comes to securing a place as a global medical destination. Mayo Clinic needs to maintain competitiveness in order to be this global medical destination. Placing additional focus on corporate responsibility can maintain and increase Mayo Clinic's already great reputation, put them above competition, and help them achieve the destination medical center status. Mayo Clinic was founded on social responsibility, which is apparent in their mission statement. The needs of the patient come first. Being socially responsible as an organization allows the organization to be sustainable, to be able to put the needs of the patients well into the future. Social responsibility can be viewed as a contract with society. CSR within organizations demands great ethical, moral, and discretionary responsibilities as well as legal and economic obligations. Stakeholders and secondary stakeholders are responsible for the CSR within most organizations. These levels or responsibilities ensure the achievement of success in corporate stewardship. Economic responsibility is the first level. Profitability is necessary for an organization to give back to society through providing jobs to employees and producing goods and services that are needed by consumers. The objective is to maximize the profits for the shareholders and owners. The second level is legal responsibility. Businesses are required to be profitable within a legal structure. Regulators and government agencies establish these rules that must be followed. Global stakeholders require businesses to meet country, state, and city legal responsibilities. The third level is ethical responsibility. Leaders within the organization must use equality, fairness, and respect to achieve organizational goals. Global stakeholders expect companies to be morally and ethically responsible. The highest level is philanthropic contributions. The highest level for a business to give back to society is through philanthropic contributions, such as discretionary responsibility. Discretionary responsibility is voluntary and is not required. The goal of the business is to improve the welfare of the community and society as a whole. In a business context, customers and investors and shareholders, employees, suppliers, government agencies, communities, and many others who have a stake or claim in some aspect of a company's products, operations, markets, industry, and outcomes are known as stakeholders. The stakeholders involved are definitely the primary stakeholders. The main people affected by such employers' actions or lack thereof include the employees, investors, and community. By not acting ethically and not displaying social responsibility, the organization may falter due to employee turnover, lack of business, investors losing interest. Employee turnover may occur if the organization's moral and ethical standards are not in line with that of the employees. The organization may suffer as well because if employees feel unethical actions are tolerated, they will act unethically. Every single action directly affects the community, including the organization's business practices. Human resource professionals are invaluable assets to organizations. They bridge the gap between the values as well as creating meaning and purpose for employees within the organization. Corporate social responsibility demands ethics. Human resources has the ability to connect individual morale with corporate responsibilities that shape the culture and create an environment with ethical integrity. The first most valuable responsibility for an HR manager is the role of the culture keeper. In order for an organization to develop corporate social responsibility within their organization, they must consider the current culture of their organization. This can be developed through modeling, emphasizing, and continuous reference to ethical practices of the organization. Second, human resource managers must be able to cultivate individual relationships with employees. This helps the employee understand his or her sense of purpose, value, and meaning to the overall ethical responsibilities of the company. When employees feel they have a sense of purpose, they will be more willing to invest into the social responsibility in the workplace. Human resources are involved in the employee's work performance. They are connected to the employer's work history as well as to the corporate objectives to the company. Human resource professionals are critical when it becomes necessary to intervene during moments of ethical ambiguity, which can allow for course corrections before bad decisions are made. Mayo Clinic has started a model to address some of their food waste, which entails allowing unconsumed food to be purchased or donated to local farmers to feed hogs and mink. This is a step in the right direction and does positively affect the community in a great way. Hog farms get food for less money and are able to pass those savings on to consumers. Although this is a step in the right direction, more can be done to benefit the community and a larger share of the organization stakeholders. There are many creative solutions to ending food waste in cafeterias. The cafeterias of Mayo Clinic should create a more comprehensive food recovery program that suits the organization and the community. The food recovery program for this model will address cafeteria and overall food waste at Mayo Clinic. The first step is to prevent food waste in cafeterias and reduce overproduction and poor food management. Next is to separate waste into categories like recyclables, food to be donated, upcycling bins, and general trash. This not only helps with food waste, but general waste as well. The food to be donated that is discarded by consumers would be unopened items such as milk containers and applesauce. The upcycling bins would be kept for donating to local farmers or for composting. Currently, Mayo gives the leftover cooked unsold food for local farmers. Any edible items should be separated into meals and donated to the food shelf and other programs such as Meals on Wheels to provide a meal to people in need. The upcycle bin of discarded food would then be set aside for livestock feed, as it is unethical to give food to livestock that is consumable by humans in need. Any inedible leftover unsold items can go to the upcycled waste. Volunteers would be near waste receptacles during busy times to educate consumers on where their waste should go. This would represent the employee and visitor cafeterias as well as inpatient room food deliveries for patients with non-communicable diseases. In addition to food waste left behind via consumers, any food items that used to be thrown away on their sell-by or use-by dates will be kept track of via inventory. If these items are expected to not be used on these dates, they will be donated to the local community. If the items are expected to be used and end up not being used, they will be upcycled for compost and livestock feed. To further address the issue and eliminate food waste, it is asked that any organization who takes the food for human consumption saves any waste to be upcycled for compost and livestock feed as well. Bins will be provided to these organizations. Cafeteria management utilizes the point-of-sale system to keep track of how much food is sold, trends in sales, etc., and presents this to cafeteria management in order to order the proper quantity for stock and also determine what will be cooked for today and prepared for tomorrow. Employee A goes to the cafeteria for lunch and after she is done eating realizes she purchased more than she really needed and will be off for the next few days, so is unable to save it for herself for later consumption. She goes to the waste area where a volunteer directs her where to put her trash. The bottle of orange juice, which is unopened, is to be donated, and the half-eaten lasagna to be upcycled. Many employees eat all of what they purchase. Those who do not upcycle or classify unopened items for donation by putting them in the correct receptacles. At the end of the day, there is half a tray of lasagna unsold as well as various sides. Food service allows their food recovery guidelines and puts portions of each consumable unopened food item in recyclable containers to be donated. Inedible or open items go into the upcycle receptacles. What is not taken by the local farmers for the upcycle bins is set aside to go to the county composting site. The people who took the meals donated yesterday return their containers along with any upcycled material. The new model is applied and zero food has been wasted. Mayo also utilizes community outreach to connect medical institutes, academic researchers, and stakeholders to build awareness and develop action plans to address the needs of the community. This outreach can span from the delivery of services to the dissemination of information. Community outreach is a critical component to reaching unmet health needs in a community. Community outreach is an activity that many businesses involve themselves in to better the area around their business. Community outreach can provide assistance and services to those in need or do not have access to the services that businesses provide. By providing community outreach, businesses are making their business visible and transparent in the community as well as giving back to their community. Outreach can also move out of the local community to involve national and worldwide organizations as well. Organizations can partner with others to provide further outreach extending out of the area. Mayo Clinic provides community outreach to numerous community members as well as organizations in the area and throughout the world. Mayo Clinic supports organizations to enrich the lives of others through education activities. Mayo Clinic partners with businesses in the area to provide better opportunities in the community. The clinic also provides assistance to those who are unable to afford health insurance to pay medical bills, as well as access to health care for those who cannot afford care. Community outreach can enable disadvantaged people who live in the community as well as around communities that their partners support. A few of the organizations that Mayo Clinic partners with are the YMCA, Salvation Army's Good Samaritan Health Clinic, the Chamber of Commerce, the Business Development Center, and United Way. Mayo Clinic community outreach is especially important when it comes to responsibility to those who need health care. The campaign for Mayo Clinic advances that cause by accelerating discoveries and bringing life-changing treatments into practice for patients. By partnering with organizations that embody the same vision as Mayo Clinic, the clinic is able to change the views of health care and evolve in their care and mission. Through the Giving campaign, employees are able to invest in their business as well as donate to United Way. Mayo Clinic and United Way partner together to provide educational, financial, and health assistance to those in need. Mayo Clinic uses an employee-based strategy to send a message that support is needed in the organization and get employees to donate to the cause. There are many strategies that businesses use for community outreach. These strategies can depend on the type of business or organization as well as the vision of the outreach that they choose to do. Some strategies of community outreach are media, community engagement or meetings, training, television, billboards, radio, cultural activities, as well as entertainment. Though community outreach strategies and mass media campaigns are two distinct strategies, the most effective examples of such approaches tend to combine mass media intervention and community-based action. In order to increase community outreach in the future, Mayo Clinic will put together a small community outreach committee. The outreach committee will be formed within 30 days. Upper-level management will decide on the people to represent each department in the outreach committee. The outreach committee will be decided and a plan given to them directing them to research further community outreach activities that the clinic can get involved in. The outreach committee within 60 days will hold 2 meetings to brainstorm areas where they can continue outreach as well as increase their future activities. The members will delegate areas for each member in the committee to research, and in the second meeting, the committee will bring all their ideas together and vote on what activities will be the most beneficial to involve the clinic in. The outreach committee within 90 days will bring their list and ideas to the upper-level management and present their proposal for action. Management will decide whether or not to participate in the activities that were found by the committee. The outreach committee will then begin the delegation of tasks to each of the members to begin working on the projects. By separating the committee into small groups to focus on each activity, the program will be better implemented in the community. Mayo strives to identify strategies to enhance inclusion in diverse populations in research. Research for the public good involves a deep understanding and appreciation of communities' needs and concerns. Investors must understand what it means to conduct socially responsible research. It is also important to consider the stakeholder and the importance of including these individuals in community engagement and research. Mayo focuses on ensuring their stakeholders are engaged in this process. Mayo Clinic uses effective community-based research that requires new approaches and methods. Community-based participatory research is a well-defined strategy for engaging communities in research. Mayo Clinic, one of the world's foremost leaders in multifaceted medical practice and research, continues to advance within the ranks of its community. So too does its footprint regarding its positive effects towards effective social responsibility. Long has the medical industry been sustained upon the principles of human health, but in recent years the swing towards improving sustainability in the form of best practices has only increased. In recent years, Mayo Clinic has developed a department and push towards consistent medical innovation that focuses primarily on patient experience, professional innovation, and practical care continuity. For an organization to be definitively sustainable, its organizational goals must align with the concept of practices for the improvement and greater good, regardless of which type of industry the organization falls within. In the case of Mayo Clinic, the drive towards sustainable practice is evident as it pertains to groundbreaking research that happens on a continuous basis with the end goal of improving clinical and public health practices. From the clinic's early years at the turn of the 20th century, practices of innovation techniques to include, for the time, groundbreaking administrative and patient care practices implementation was first researched by the founders and then implemented to create the best possible partnerships in medical practices. Corporate social responsibility, as it aligns with the core values of medical practice, and to Mayo Clinic specifically, has consistently gone above and beyond its focus toward patient care, and well as conducting nearly never-ending medical trials and research for the greater public good. The effect that Mayo Clinic has had upon medical innovative practices is truly astounding. In order for there to be increased towards sustainability, a committee created towards innovation would need to be formed within a 30-day period. Within a 60-day time frame, the committee will need to determine key areas of medical research that could have the greatest impact on immediate community health. Within 90 days, these ideas would require solidification in order for action to be taken on these chosen critical areas. In conclusion, in an overview of the presentation, we discussed the organization overview, what corporate social responsibility is, leadership competencies tied to corporate social responsibility, and the current initiatives and the increase of these initiatives within Mayo Clinic, including food waste, community outreach, and research. The final goal of organization should be to enhance or continue its strategic philanthropy. In addition to the current efforts, Mayo Clinic can donate to nonprofit organizations that demonstrate creativity, diversity, and an innovative approach, much as they do, and who are also in line with their own values and goals.